Hello everyone, my name is Dr. Dominic Kelly. I'm a consultant cardiologist here at Hampshire Hospitals. I've worked here for 11 years now. I'm also involved with the development of the clinical models for the new hospital that is being proposed. I'd like to talk to you today about the benefits of bringing specialties together within a large acute hospital, which is how we propose to provide clinical care in our clinical models. Clinical medicine is becoming progressively more complicated. Patients are getting older, lots of comorbidities, and more complex. We also know that actually the delivery of that clinical care is becoming more complex. So, for example, in my own specialty of cardiology, we no longer just have cardiologists, we have cardiologists with subspecialty interests. So there'll be some of those that have interests in the coronary arteries, for example, others more involved with the electrics, etc. The importance of bringing together all specialties is that when patients need that specialist care, you'll be able to see the appropriate people to deal with your individual needs. That's especially important when people are critically unwell. If you are in the back of an ambulance needing specialist care, what the data suggests is that when those ambulance doors open, the most important thing is that you're seeing the right person at the right time to deal with your condition. And that becomes progressively more difficult to deliver if you're spreading your staff over multiple sites because you need to duplicate those services. We also know that outcomes are related to how much individual centres do, their volumes, and also the volumes that individual operators, surgeons, or physicians see or do. So by centralizing our services on one site, it means that that hospital is doing more of each condition and individual doctors are seeing more of the conditions that they are best served to look after. And as a result, we know from multiple studies across lots of specialties that patient outcomes are improved, complication rates are reduced, and patient satisfaction is greater. So, in summary, bringing specialties together on a single site means that you will see the right person at the right time. That person will have the appropriate training, experience, and volume of procedures or operations or treatments that they've done over time so that their outcomes for you as a patient will be improved and your satisfaction with the treatment will be better. We also know that as patients get older and our population is aging, patients no longer just have single problems, they have multiple problems. They may have a heart problem, but also a lung problem, kidney problem, etc., etc. So another one of the benefits of bringing together specialties on a single site is that patients that have problems that span different specialties can see those individual experts at the right time. So if somebody is in hospital, for example, with a heart condition, but has associated problems with their kidneys, there'll be appropriate staff, consultants, doctors, nurses on site to be able to deal with those additional problems. And as our population ages, as we know it will, that will become more and more important. It's also important in terms of outpatients as well, because we now are in a situation where patients almost become professional patients. They will come and see their cardiologist on a Monday, their renal physician on a Tuesday, their respiratory physician on a Wednesday, and they literally spend their whole life going to hospital appointments. So one of the benefits, again, of bringing together hospital services is to try and streamline that outpatient into one-stop services. So rather than seeing different specialties on different days, the future vision will be coordination of those appointments so that patients can see their cardiologist, their renal physician on the same day. That's, of course, a benefit for patients. It means single visits. It's much more convenient. It's also a benefit for the environment as well in terms of travel to and from hospital and that green agenda. So as well as being beneficial to our patients, there'll also be benefits for our staff. So by bringing together specialist staff, we will be able to create more sustainable rotas, which are better for staff working and working-life balance. We'll also be able to cover a greater amount of hours through the working day so that whatever time of day patients present, we'll have better coverage for those specialties. What we'll also be able to do is create a critical mass of staff as well. So one of the difficulties we have in recruiting staff is that if there is not a perception that rotas are filled, etc., staff are reluctant to come and work in places because they have concerns over needing to cover additional shifts and all those things like that. So by bringing together the staff and having those sustainable rotas, we will attract staff to our excellent hospitals. And then the final thing is, if all this is packaged up within a beautiful new hospital, we all know that working in a nice surrounding with appropriate space for our staff, appropriate facilities for well-being, again, will attract our staff to our hospital. So we will have a facility that not only provides excellent care, excellent environment, but will be a great place to work for our staff in the future.